Hi everybody, my name is Dakota Garcia, and for my research topic I chose depersonalization, derealization disorder. Now, what exactly is that? It is a type of dissociative disorder, and specifically it's a dissociative disorder in which you are feeling moments of separation from reality. And for the causes, there's no specific causes, but there is a couple theories on what could be causing it. One of those theories being neurotransmitter imbalance. Neurotransmitters simply are neurons that transport messages to other cells. Now, if you are getting incorrect messages or not receiving the messages in general, the cells will still have to react accordingly. Now, whether they are acting correctly is obviously up to the transmission and receiving the correct information. Another theory is severe stress or severe trauma. Now, both are related, but both can be different. Severe trauma could be a childhood trauma that you experienced. Severe stress could be something from any daily life. It just has to be severe enough to affect you that much. Many that have experienced the depersonalization, derealization disorder have described it as being similar to having a panic attack, which is stress-induced. Now, as for the symptoms, according to the DSM, you are unable to control normal functions and you're having a fragmentation of your identity. Your identity feels broken. It feels like it is not you anymore. You are not connecting with what you once did. Treatments, there are several treatments, but there is no singular treatment, unfortunately, that is 110% verified to be the fix. But there is help. There's counseling and therapies, such as the psychodynamic therapies or the cognitive behavioral therapies, and really these therapies just want to get to the root of the problem and see if it's in your conscience, see if it was a trauma that was experienced, and try and change or work with you to see if you can work through this. Now, there is medications. Now, however, these medications are not specifically for the depersonalization, derealization disorder. These medications are actually generally going to be anxiety or depression medications. Now, the anxiety medication ties in directly with the severe stress being a possible cause of inducing the depersonalization disorder, and the depression medication could be related directly to any trauma you experienced. Now, names that you might recognize as an example of these medications would be maybe Prozac or Klonopin. There are, however, other names, other brands that will treat it. Now, there's also support, whether it be from your friends or your family. Support is really vital in helping heal or helping try and control any disorder or even physical problem that somebody can have. Healthcare professionals, however, is the key to getting better or at least figuring out what you need to do to get back to your normal life so that you are not feeling this debilitating disorder on your back anymore. So maybe you can connect with your reality and gain some bit of normalcy again. Such as was the case with Jane Charlton, a young woman I came across in my research. She was a normal 18-year-old college student and she went to a party with her boyfriend and she wanted to try marijuana. It would have been her second time trying it, and she mixed it with yogurt, tried it, and she noticed after a while that the effects were not wearing off. Well, she woke up the next morning and she still felt separated from reality. She still felt as if she was not living her own life. She was just going through the motions. She went through that for 3 years. 3 years of not feeling the reality that she once did. She wanted to feel what she had felt the day before she went to bed and woke up, and she still wasn't better. She is a big advocate for the depersonalization, derealization disorder, and she really wants to bring awareness to the mental health situation and get others the help that they need. And she stresses, as I said earlier, to get with a medical professional to find what can help you fix this disorder or get back to your normal everyday life, because it is not something you have to live with. There is help. So I hope I addressed a majority of what I could about the depersonalization, derealization disorder. Obviously, we have to leave questions, so leave your questions below, questions, comments, concerns, and I will answer those in the next video. So have a nice night. Thanks.